Good afternoon and welcome to today's U.S. of Care State Call to Action Telebriefing. During the presentation, all lines will be in a listen-only mode. A question and answer session will follow the presentation, and instructions for asking questions will be given at that time. Thank you for your attention. I would now like to turn the conference over to Joanna Dornfeld.
Hello, everyone. On behalf of the United States of Care, welcome to our telebriefing on recommendations for state action to respond to COVID-19. My name is Joanna Dornfeld, and I serve as Senior Director of State Affairs for United States of Care. We have a fantastic set of speakers today, and I'm honored to introduce them to all of you. Liz Hagan serves as the Director of Policy for State Engagement at United States of Care, where she focuses on state policies to improve and expand health coverage. Before joining United States of Care, Liz was a senior consultant with Transform Health, where she focused on federal policy and implementation of Sacramento's Whole Person Care pilot program. Prior to her role at Transform Health, Liz was the Associate Director of Coverage Initiatives at Families USA and a policy analyst with Enroll America, where she primarily worked on eligibility and enrollment policies for Medicaid, the Children's Health Insurance Program, and Health Insurance Marketplace, as well as coverage for the justice-involved population. Our second speaker is Congressman Charlie Dent, who currently serves as a Senior Policy Advisor to DLA Piper, where he provides strategic advice and counsel on a wide range of issues, including healthcare. In addition, Congressman Dent is a political analyst for CNN, a visiting fellow for the University of Pennsylvania, Perry Worldhouse, and a distinguished advisor for Pew Charitable Trusts. Prior to those positions, Congressman Dent served 7 terms in the U.S. House of Representatives, representing the 5th Congressional District of Pennsylvania. During his time in Congress, Congressman Dent distinguished himself as a strong independent leader who was well respected on both sides of the aisle. He was a senior member of the House Appropriations Committee, where he chaired the Subcommittee on Military Construction, Veterans Affairs, and related agencies. Before his time in the U.S. House of Representatives, Congressman Dent served for 6 years in the Pennsylvania State Senate and 8 years in the Pennsylvania General Assembly. Congressman Dent is also a member of the United States of Care's Founders Council. Our last speaker, Councilor Lon Sena, represents District 1 of the Albuquerque City Council. Councilor Sena was born and raised in Albuquerque. She earned both her bachelor's degree in political science and a master's degree in health administration from the University of New Mexico. Councilor Sena has worked in health policy and advocacy after personally experiencing cancer. She has worked in healthcare policy at the city, state, and federal levels before being appointed to her position as a city councilor. She is an active community leader in her neighborhood association and the Asian Pacific Islander community of Albuquerque. As I said, I'm Joanna Dornfeld, Senior Director of State Affairs for United States of Care. Prior to joining United States of Care, I served as Chief of Staff to Minnesota Governor Mark Dayton and have more than a dozen years of experience working in both the legislative and executive branches. Again, thank you to all of our attendees and our great speakers for joining us today. At United States of Care, it is our mission to ensure that every single American has access to quality, affordable health care, regardless of health status, social need, or income, a mission that has never felt more relevant and is only underscored by the acute needs during this public health crisis. Over the past 8 weeks, we have shifted our efforts to focus on providing immediate support to state and federal leaders in their COVID response. Together with state and federal officials, entrepreneurs, and healthcare advocates, the United States of Care has identified trends and best practices across the country. We have begun to plot a path forward for federal and state governments to grapple with the immediate and long-term fixes that meet the needs, fears, and hopes of individuals and families across the country. This briefing is United States of Care's 6th in a COVID-19 focus series in which we bring frontline experts to state leaders, congressional staff, and health system stakeholders. We're proud that we tried to do this in a unique way by bringing together different perspectives to speak with folks like you, from national experts to those doing the on-the-ground work in their own communities to everyday people all across our country. We know that state leaders have been taking unprecedented action over the past few months to respond to the COVID pandemic. We also know that different states are at different stages of your response due to the spread of the disease. Governors have taken important steps to evoking emergency orders in order to quickly align existing resources and response efforts. However, legislators will continue to play a critical role in states' ongoing response efforts. Many legislatures will be coming back into session after recessing due to the virus, or coming into special session in order to address critical measures that can't wait until sessions reconvene in 2021. The coming months will continue to bring significant health care and economic challenges both for those who contract COVID-19 and require care and for those whose access to care is threatened or disrupted. Reliable access to affordable care is all the more critical during a public health emergency, and there is a time-sensitive need to pass policies that respond to immediate healthcare, fiscal, and safety concerns. The pandemic is illuminating structural gaps in existing policies that can and should be addressed for the immediate and longer term. On our call today, Liz Hagan will share United States of Care's recommendations for actions state legislatures should consider in the coming weeks to bolster state responses to COVID-19. We know that these recommendations are focused on the immediate and medium term and that much more work will be required in the coming months as we head into 2021 sessions to address the longer-term impacts of the public health and economic crises. After Liz's presentation, Congressman Dent and Councilor Sena will each spend a few minutes to share their perspectives on what they are seeing in states and their recommendations for what state leaders should be working on in the coming weeks. At the conclusion of the presentations, we will then open the call for moderated Q&A. Instructions for how to ask a question will be given at that time. We would also welcome hearing from all of you what important actions you are seeing in states and what other state leaders might want to consider. Again, I'd like to thank all our speakers for joining us today, and I'll turn it over to Liz Hagan to walk us through United States of Care's call to action, state legislative recommendations to address COVID-19.
Thanks, Joanna, and thanks so much for joining us today. I'm Liz Hagan, Director of Policy for State Engagement here at the United States of Care, and I'm really happy to be joining you all this afternoon or morning, depending on where you are in the country. Today I'm going to share with you some of the priority areas state legislators should focus on when they return to session. States should continue making progress on responding to COVID and the needs people have related to that, but also they should continue to craft solutions aimed at addressing the issues people faced before COVID hit and will continue to face moving forward. These priority issue areas fall into four broad buckets based on what we know to be true about what people need and what they want out of a state response. The policies we will highlight respond to the following needs people have based on our research. The first is that people want to be protected and provided with clear recommendations and steps they can have to remain safe and avoid getting sick. Second, people want a reliable healthcare system that adequately supports frontline workers. Third, people want financial and healthcare security they need to weather the impacts of COVID. And lastly, people want equitable and responsive healthcare safeguards that meet the needs of the most vulnerable. So for the first priority, what policies can state legislators enact to protect people and provide them with the guidance about how to remain safe and avoid getting sick? It's important to ensure that data are collected, such as the number of COVID-19 tests performed and the measures of hospital capacity, and that information like that is provided to people based on best practices and understandable messaging. This needs to be done in a timely manner so that people are not confused or left without answers to important and timely questions that they have. State legislators also need to protect people from getting and spreading COVID. This ranges from protecting people in long-term care and skilled nursing facilities to protecting post-acute care to providing post-acute care to people during the period of time they are recovering from COVID to establishing places for people to self-isolate. For example, we know that a critical component to protecting people from the spread of the virus is to provide isolation facilities to better enable people to quarantine. These can serve people with COVID symptoms, people in untenable living situations, and or people at high risk of being exposed to the virus, such as essential healthcare workers. To address this, for example, Minnesota legislators introduced legislation that would require health plans to cover quarantine services related to COVID, and notably, it would be covered without cost sharing. It's also critical to provide protections for those providing care through home and community-based services, such as nurse aides, home health aides, family caregivers, and personal and home health care aides, through policies like designating all direct care workers as essential personnel to ensure access to personal protective equipment, or PPE. States also need to provide resources to implement contact tracing, a public health tool that was the focus of our last Tele-Briefing, which can be done through utilizing existing programs in state health departments, expanding executive action, pursuing public-private partnerships, or creating app-based solutions. Without an influx of federal funding, such as the one we and many others have pushed for, many states, however, will not be able to mount adequate contact tracing programs to meet the needs of their residents. While not adequate on their own, app-based solutions may be a tool states can deploy as part of a broader contract tracing effort without additional federal funds. Additionally, states should create consumer assistance programs to help the many people facing disruptions in their healthcare coverage to navigate their healthcare options. New Jersey, for example, just yesterday announced the launch of a campaign to do just this. Second, states need to take action to respond to people wanting a reliable healthcare system, one that reliably and adequately provides support to frontline medical workers. One way of doing this is by increasing the healthcare workforce capacity by waiving scope of practice and licensure requirements to allow more people, such as out-of-state providers or retired medical professionals, to provide care to those in need and ensure those licensed within the state are able to care for patients to the full extent of their abilities. Critical to this is pairing these waived requirements with expanded training and assessment to ensure people are still receiving adequate and quality care. States should also ensure that rural and critical access hospitals, which we know face unique challenges, are supported by expanding access to funding. And states can develop comprehensive frameworks to address mental health care needs as physical distancing measures take a toll on people's mental health, including frontline medical workers in high-stress situations. States should also expand mental health care services, develop a community workforce, establish statewide COVID mental health lines, and support alternative payment models for care. One second. I just have a pause for 1 second. Okay. State leaders have a challenge. Sorry, one second. Sorry, states should take action to respond to people wanting a reliable healthcare system, one that adequately supports frontline medical workers, as I mentioned. And the third area is that states should prioritize in response to people wanting financial and healthcare security, especially during these uncertain and challenging times. States can take action to protect against high out-of-pocket costs, such as waiving cost sharing for COVID treatment and protecting people with surprise medical bills, which no one should have to face, especially right now. This can build up the many efforts states took prior to COVID and protect people from high out-of-pocket costs, which we know can deter people from receiving care. States should also explore ways to expand access to telehealth services for people with all coverage types, such as Medicaid, marketplace coverage, and employer coverage. As people continue to physically distance, they will need to access healthcare in different ways than before, and telehealth is one of many important ways to improve that access. Protecting and expanding services and coverage through Medicaid is another area for state leaders to prioritize, especially as people rely on the safety net program. While a lot of action has taken place from governors in their administrations on Medicaid, state leaders can take action to protect Medicaid as well. For example, following the lead of pending legislation in Alabama, states should extend postpartum Medicaid coverage for beyond the traditional 60 days period to a 1-year period for new moms as they address disparities and remove financial barriers for this critical population. Of note, the Families First Coronavirus Response Act passed in March requires that states do not disenroll pregnant women from coverage 60 days postpartum, but this is only for the duration of the national emergency. So there is opportunity for states to offer that coverage beyond that designated window. And as another way to address affordability concerns people have, states should enact legislation to improve access to insulin, which is all the more critical since this population is at a greater risk for serious complications related to COVID. These efforts were underway prior to COVID and are all the more critical now. Finally, state legislators should respond to people's desires for an equitable and responsible healthcare system, one that meets the needs of the most vulnerable. To do so, states need to establish coordinated data collection to address needs and gaps. Special attention needs to be paid to vulnerable and minority communities who we know are at high risk and are experiencing very troubling and disparate outcomes. Data collection can also aid and inform the crafting of future policy plans, including the plan for future surges. Lastly, while states should take a comprehensive approach to people's overall health by addressing social determinants of health, including through Medicaid programs such as what North Carolina has done through their Healthy Opportunity Pilot. State leaders have challenging paths forward, responding to their state's public health care needs, as well as responding to declining revenues. We're learning more every day about what people expect and what they want to see from their leaders. State leaders will continue to be nimble, need to be responsive, and need to be proactive as legislatures come back in session over the next few weeks to respond to their constituents' immediate and long-term needs. And while not a focus of the call today, I did want to raise another issue that states are now grappling with, which is related to future waves of the pandemic hitting. While we don't know when and where future surges will hit, it is an uncomfortable truth that there will be future surges, and state leaders need to plan for that. So stay tuned in the coming weeks for more information and guidance we will have to help state leaders continue creating preparedness and contingency plans to that end. State leaders will play a key role alongside their governors and administrations in crafting well-developed state responses, and we'll have more information on that for you soon. If you have questions or need technical support on these or other policy issues you're grappling with, please do not hesitate to reach out to us at United States of Care. We're happy to be a resource to you as you continue to lead through this public health and economic crisis. At this time, I will hand the call over to Congressman Charlie Dent, who will shed some additional light on this topic and share his perspectives as both a former state legislator and former U.S. representative. We're happy to have two great U.S. of Care Founders Council members on this call, starting with Representative Dent. Representative Dent, welcome, and thank you for being with us today.
Well, thank you, Liz, for that introduction, and welcome to everybody on the call. Again, I'm Charlie Dent. I had served 14 years in the U.S. House of Representatives and 14 years in the state legislature in the Commonwealth of Pennsylvania, 8 years in the State House and 6 years in the State Senate. So those of you who are on this call who are at the state level, I am very sympathetic with your plight. And I thought I'd focus for a moment on maybe a little bit on the budgetary side of this. I mean, I know that states like mine are facing revenue shortfalls now, probably in our state's case around $5 billion, which is a huge number, eye-popping numbers. And this, of course, is keeping everybody up at night. And, you know, the budget really does dominate much of how our state operates and how the legislature operates. It and really dominates the whole political scene in the state. And I guess the few things that I would recommend to you right now is that, of course, Congress is now in the midst of enacting this next phase. I'm going to call it Phase 4 of the pandemic, the COVID relief packages. So this is on the table. I do not expect there to be any agreement on this thing, certainly not before this weekend. And in all likelihood, there may not be an agreement before 4th of July. That said, now is the time for you and your governors and the whole state leadership to talk to Washington about what your immediate needs are. Certainly, state and local government relief will likely be a major component for this upcoming bill. And that you need to make sure that your interests are preserved to help you make up for lost revenue and also COVID-related expenses. Of course, Washington is going to be watching you too to make sure that whatever you do with the money, whatever the states do with the money, that they're not going to use any of this money to fund some of their unfunded liabilities and other issues that were unrelated to this crisis, and wanting that they don't want to really deal with your legacy costs. So make sure you're ready to speak to those issues. Another important issue that Liz touched on that I thought would be of concern to you, I knew it was a concern to me when I was in the legislature, of course, is Medicaid, which I suspect in all of your budgets is probably your largest line item along with your support to your school districts. So you think about it that way. And, of course, Medicaid is countercyclical. That is, you know, when the economy goes into recession, or the economy in this case is tanked, your revenues to the state drop considerably, and of course the need for Medicaid, the demand for Medicaid increases significantly as people are laid off and lose health insurance or their jobs, or both. And so you know, the temptation, of course, is then as you're trying to deal with your budget, is that you have to cut where the money is, and Medicaid is one of those places. So as this federal relief package is progressing, it's important that you articulate to your members of Congress your need for some kind of relief on an enhanced FMAP, the Federal Medicaid Assistance Program. I mean, this is probably that would probably do more than anything else, I think, to help you navigate this crisis, because you don't want to be in a situation where your citizens are coming to you, your constituents are coming to you with concerns about Medicaid and not having access to health care. And so this is something that would probably be the most important thing, among the most important things you can do right now to protect your states from this immediate crisis. So those would be my quick thoughts. Again, I would urge you to move quickly because I don't believe there's going to be an agreement on this thing too soon. But they're working this bill now. In addition to the regular order appropriations bills in Washington, this is the season for that too. Those bills will start moving in the House in June, so you can never be too early in making your requests now. Other issues of concern that I've been following closely, there'll be a need for more doctors, more residency spots, more healthcare professionals. We have to make sure at the federal level that continues, that those types of programs are funded, for graduate medical education, for example, to make sure that the that the flow of doctors and residency spots are available for those who will be coming out of our medical schools. So those are just a few issues, and of course we all know right now that your demand, your need for testing is quite high, and that has always been my view, that testing, tracking, tracing, therapeutics, and of course ultimately a vaccine. But I think all of you at the state level have to be prepared that you have to plan. I should say you should plan that there will be no vaccine. We're all hoping that there will be a vaccine, and we hope it will be sooner rather than later. 12 to 18 months is an aggressive schedule, but even there is a possibility there will not be a vaccine. So we have to figure out how to manage our lives around this virus as the reopenings are occurring. You have to keep that in mind. So plan as if there will be no vaccine, even though we're all hopeful that there will be one. And I guess my final comment would be, and curious to hear what you have to say at the state level, that you should also, as you go about reopening your states, I think it's probably a good idea to get a good sense of what your neighboring states are doing. I know in Pennsylvania, for example, there are certain there are certain types of businesses that are not open here, but that are open in neighboring states, which is creating some issues and some confusion. There have been issues too here with respect to essential businesses and non-essential businesses, or life-sustaining or non-life-sustaining businesses, and how they can having greater clarity in terms of what those rules are. There have been some real issues in our state, and it's gotten to the point now where some counties have been openly rebelling against the governor, essentially, and the Secretary of Health, in terms of the pace of reopening and defying the state's orders. So to the extent that you can provide very clear rules to everybody in this situation, I think would be of enormous benefit to your constituents and particularly your small businesses. So that, I thought I'd stop right now and be happy to take any questions at the appropriate time.
Thank you so much, Congressman Dent. I really appreciate your comments and being here today. And we will be taking questions at the end of our presentations, but now I would love to turn it over to Councilor Lon Sena from the Albuquerque City Council.
Thank you for that, Joanna, and thank you to Congressman Dent as well. For me, as a city councilor, I'm going to be giving a brief overview and insight as to what really it's been being on the ground in the city of Albuquerque. We are one of the bigger populations for the state of New Mexico. We've, in response to COVID-19, the city has been providing housing vouchers, funding to nonprofits that have been able to kind of fill in the gaps in terms of providing equity for our most vulnerable populations, for food, housing. Our city has also just recently provided its over 10,000 meals just to our senior populations, making sure that grocery deliveries are being made. And for me, I've also been providing town halls in multiple languages in ensuring that our communities that are limited English proficient get all of the information as things are changing so rapidly in a language that they understand. As for our state, we are fortunate to have a great governor in providing really great leadership. Even before the pandemic had hit, we did have policies in place to protect those with pre-existing conditions. We passed insulin caps, and we evaluated the licensing and the scope of practice, and also eliminated surprise medical billing. We are a leader, I would say, in telehealth because our state is actually very sprawled out. We have a very rural state here. In terms of COVID response, our governor actually directed our Office of Superintendent of Insurance to provide free testing for COVID, as well as insurance coverage to pneumonia, the flu, as well as COVID, and expanded workers' compensation. But of course, as Joanna had mentioned, the virus has also shed light on what systems are still vulnerable in these times, and what work needs to be done. For us, we need a continued partnership, whether it's through our cities, our counties, and our state. For us, evaluating our neighbors within the Navajo reservations, them having the greatest impact as it comes to infectious rates and death rates due to COVID-19. So just trying to be a good neighbor with our cities and our counties. Our governor has actually allowed some flexibility of some of the counties reopening, with also in respect being aware of our neighbors within our reservations, and being respectful and knowing that they are seeing these greater infectious rates and trying to be responsive to that. In terms of a partnership for our cities, I know that there are some conversations because some of the more populated cities got more funding from federal relief. However, as state legislatures go into session, for us, we're going to probably go into a special session mid-June. As for our state, a lot of our revenue comes from oil and gas, and if that does not pick up, our cities are going to be the engines of recovery. So we hope to be great partners with the state in thinking of what may happen and where our cities can be providing some help, but also the cities also need some flexibility with funding to see some of that aid. For us, our hospitals are mainly concentrated in the city of Albuquerque, and so we also need assistance there for the population. And really, all of this is really an investment on our communities to be aware of these health inequities and, of course, the social determinants of health. But I just want to close in saying that being uniquely situated as a policymaker now, while also being considered in the vulnerable communities and still actually going through active cancer treatment, and thinking about who we're doing this for. We started a lot of the self-isolation, the quarantining, because of our vulnerable communities, having had a town hall with cancer patients and what it's like being in the time of COVID-19, and really having these discussions of what families are having to make. The threat of going to work and possibly contracting the virus and having to go home to a loved one that's vulnerable is quite terrifying to them. And so just being cognizant and aware as we're making these policies of possibly opening up, of being aware of what those communities are going through and the challenges that they are facing as well, and just being cognizant of that as we make these policies.
Thank you so much, Councilor Sena, for sharing your perspective both as someone experiencing COVID as a cancer patient, but also as your leadership position in the city of Albuquerque. We'd now like to open it up for questions or comments from those that have joined us this afternoon. Certainly welcome questions, but also would love to hear about the challenges your states are facing or the important actions you're seeing in states that we might share with one another. So, Nick, can you remind us how we open up our lines to ask questions?
Of course. At this time, we'll begin the question and answer session. To ask a question, press star, followed by a 1 on your touch-tone phone. Questions will be answered in the order they are received. If you have a question or comment, please press star, followed by a 1 now. And please hold for a moment as our system compiles your responses. All right, we'll go to C. Freeman. Please go ahead.
Good afternoon. My name is Clarissa Freeman. I am with Senator Haywood's office in Pennsylvania, the 4th Senatorial District, Montgomery and Philadelphia counties, which is in the red zone for Pennsylvania, for those of you all familiar with our reopening process. I wanted to note that in terms of looking at data collection or addressing the needs and gaps for individuals in vulnerable and minority communities, Senator Haywood actually is in the process of planning a policy committee hearing to address the impact of COVID-19 on minority communities, particularly as it relates to the disparate impact in health and the correlation between the higher numbers of deaths. So I just wanted to note what was happening in Pennsylvania.
Well, I guess this is Charlie Dent here. In terms of your request, you're absolutely right about the disproportionate impact on the African American community, especially with respect to the COVID-19, and we can get into all the reasons why that may be, but it's an enormous challenge. Now, in terms of data collection, I can't tell you specifically what's happening in Pennsylvania. I wish I could. But I would use, if you haven't already, work through Rachel Levine's office, the Secretary of Health, and make sure that you're communicating with the Centers for Disease Control. They should be giving guidance to you about issues of that nature. One thing I've learned throughout this crisis is that, at least in the state of Pennsylvania, and it's probably true in most states, that we do not have a public health infrastructure. While it's quite good in many ways, many communities don't have county health departments in much of the state, and that is an issue. And so much of the data sometimes you think would be collected at that level. And in Philadelphia, I know you certainly do have a health department. I believe Montgomery County does as well. But those counties those health departments should have local on the ground data for your district, at least as best they can. It's not a great answer to your question, but that's the best I can do.
No, we actually thank you so much. We do have the data. I was just noting that we will be having a hearing on the impact in minority communities coming up. So we do have the data.
Oh, okay.
Particularly in these counties.
Oh, okay.
Thanks.
Fantastic.
Thank you. And as a reminder to our audience, you may ask a question or leave a comment by pressing star 1 now.
This is Joanna again from the United States of Care, and I might just on that conversation about data. It is an incredibly important one because I think it not only will help us think about how we continue to, as policymakers and leaders, respond to the current COVID crisis, but also as we think about how we're providing care and kind of what are those disparate impacts, independent of a public health crisis as well. I just wanted to ask a follow-up question for you, Congressman Dent. I think we've seen a lot of kind of transformative change in kind of how we're providing healthcare during this public health crisis. I think about kind of the significant transition to telehealth and telehealth practices and the changes in policy that have happened. But curious kind of from your perspective, what types, how you think about kind of opportunities for innovation and reform during this time, thinking about kind of how we can better provide care to people moving forward.
Well, I guess one thing we've learned that going forward anyway, that we've learned that telehealth, telemedicine, we've developed a greater appreciation of it, and for many people, they're now using it for the first time in their lives, although it's been around for some time. One thing I do know is we're going to be seeing one hell of a lot more telemedicine and distance education or remote learning. We're going to see a lot more of it. So I guess what I'd say to you right now is that in the health space, I think there's a lot of concern right now in the healthcare space now that as we all know, that at least in hospitals in my community, and I know it's true throughout the country, healthcare workers are being displaced, even though there's such demand for health services as a result of the COVID crisis. There are many others, particularly those who are working in outpatient settings, providing care for those who are in need of, say, elective surgeries or services, are being displaced right now. And I guess the bottom line is, what does healthcare look like after this? I mean, I think that we are going to see a dramatic change. I'm not convinced that all these people who've been let go are going to be brought back into their jobs, into these same jobs, into the health system. That's kind of a negative statement. But I fear that's the reality, because I do think that healthcare systems are going to adapt to this new environment, particularly as the country reopens, ever so slowly and hopefully safely and deliberately, but we're going to open, but into a new normal, and that new normal is yet to be defined. But I do know it will be different. And what I will say, though, again, is that telehealth and telemedicine are going to be a much bigger part of all of our lives, as people will be, in all likelihood, at least in the near term, reluctant, to engage with people physically or in close proximity. At least that's my sense. There'll be a lot of hesitancy, and particularly among, I'll say, the elderly population and others with comorbidities or other underlying health conditions, perhaps, and particularly for that population that will not be able to move back to the normal as we understood it as quickly, out of concern for their own health, or likelihood out of their concern for their own health. And so that's something that we have to consider going forward.
And Joanna, can I actually add to that as well?
Absolutely.
So, as we're thinking about telehealth, and, for New Mexico, we had Project Echo before the pandemic, and providing telehealth throughout the entire state. But now that also brings issue on equity of access of internet and broadband. As I had mentioned, a large portion of our state is rural. They don't have that infrastructure that has the internet. And for our city, even being the more populated city throughout the state, we actually had to deploy mobile hotspots for our kids within our public schools, because a lot of families didn't have access to internet, and working with our internet providers, temporarily providing free internet services for those that are low income, and just deploying these vans and buses throughout our city to allow for kids to access internet to continue that distance learning, especially since our libraries had to be closed down temporarily because of COVID-19. And so I know that our state will be continuing to look at this aspect of having broadband internet in that infrastructure throughout our state. So whatever may change or may happen as things change with the pandemic, that at least those infrastructures will still be there to continue if we have to do telehealth or continue distance learning as we're searching for the vaccine.
Thank you. Nick, can you remind us again how to open up the line and ask questions?
Of course. As an additional reminder, you may press *1 to ask a question.
Councilor Finn, your remarks made me wonder a little bit, how do you recommend leaders and elected officials think about sharing really critical public health information, but making sure that it's coming from a credible source or from a person that can really connect with your constituents? You mentioned providing town halls in multiple languages, but do you have recommendations for other policymakers as they're thinking that through?
Yes, I mean, we are trying to work with our community partners that serve a lot of these communities. Of course, as they had mentioned, limited access of internet is always an issue. So whether it's radio and providing public service announcements in multiple languages, I know we were looking at models from Massachusetts and Boston where they were sending out every time a new public health order would come through, it would be in multiple languages. And for us, trying to have public health emergency orders being translated in all of the safe harbor languages to be accessed. We're providing test site information in multiple languages as well, just making sure if it's either it's print, radio, getting onto our news stations and making sure that our communities have access to this information in a language that they understand. And for me, just being able to do these town halls through social media, through YouTube, through Facebook Live, and having our communities participate in that way, which has been different. And of course, because of the internet and through Zoom calls, we have been able to engage in a community that hasn't been able to participate in the past. So having them have these interpreters and resources and links and numbers to call, while also having systems in place to have interpreters there to get them the information that they need.
That's great. We want to provide one more opportunity for anyone who'd like to, either ask a question or share more about kind of what you are working on in your state or what kind of important action you're seeing in states across the country.
Again, as a final reminder, you may ask a question or leave a comment by pressing *1. We had one more just come through from Barbara Weber. Please go ahead.
Yes, hello everyone, and thank you for this opportunity. I have two questions. One, our state, like many states, are very much reliant on immigrant physicians and nurses, and there have been a lot of difficulties for them in getting and retaining their visas, the J-1 visas and the HB-1 visas. And so I'm wondering what can be done at the federal level to make this easier, and I'm thinking particularly as we will experience more surges and need to move people around. There's just a lot of restrictions, like they can't change employers or they can't go to a different geographical location, not to mention the immigrant stress, anti-immigrant stress that has maybe made some of those visas in jeopardy. So that's one question. And the other one is, how do we protect, should there be a treatment, hopefully, and or a vaccine made available, that it is really made available to all of our populations, and then it's made available either for free or very affordably. So I'm interested in what solutions people see for that.
Sure, Barbara, great question. Just what state are you from?
I'm from New Mexico.
New Mexico, okay. I just wanted to say something about the, you mentioned about foreign medical students. This is a very big issue. In my day job, I actually am spending some time on this topic. Many of these, so many of our physicians in this country have been trained internationally. That is, they're outside the U.S. Interestingly enough, a lot of our physicians who are trained internationally are American citizens, but what you're talking about, Barbara, are foreign-born and in all likelihood foreign-trained medical students and or physicians who are working in our country, and we need them desperately to meet the needs of our population. So they need these J-1 visas. And, of course, USCIS, U.S. Customs Immigration Service, is are probably not processing at any kind of a rate that we need right now. In fact, many of those offices, I suspect, are probably closed. So I think the most important thing that can be done is that if these particular individuals are if they are currently located in the United States on some other visa and they're converting to the J-1, or if they're out of their own countries, then it's important that they get to the embassy. If they're back in their home countries, they need to get to the American embassy or consulates and make their case as quickly as possible. If they're in the United States currently on some other visa but need the J-1 in order to stay here, I suspect these folks are going to need to get a hold of their say they're from India, get to the Indian embassy and have the Indian embassy work on their behalf to reach out to our folks at USCIS to make this happen, because I would also utilize hospitals that either currently are have spots for those physicians. I would use those hospitals also to advocate directly with USCIS on their behalf, because this is going to become an even more severe problem as time goes on. So you have to be very aggressive on this. And it's a tragedy that we have people who are trained and can immediately address the crisis, but are not going to be able to get into the country or remain in the country, whatever the case may be. And the second question you asked was regarding vaccines and therapies, and if there be no or limited or no copays for people who are going to need these. I think that is the hope right now, that as I'm following these legislation in Washington, it seems that there is a desire, at least for the indigent population and those who are really struggling, that they not have to make any payments for a vaccine or for other COVID-related therapies. I mean, I think that's where they're moving. Obviously, insurance too, private insurance. Those who have insurance hopefully will be covered to a significant extent. But I think the movement is to try to make sure, at least for the underserved population, that they not experience out-of-pocket costs as they receive treatments or vaccinations.
And this is Liz Hagan. I just wanted to jump in real quick. I totally agree on the second point that Congressman Dent was making. I would just emphasize the fact that we don't know yet when a vaccine is going to be coming, but absent state or absent federal action, states can certainly take action like they have done on cost sharing for treatment. For example, we know that there's already legislation enacted that prevents cost sharing for testing, but additionally for treatment. And then as the vaccine progresses, that's certainly an area to pay attention to at the state level and at the federal level.
Thank you. And we had no additional questions at this time.
Well, thank you, Nick. And thanks to all of you for joining us this afternoon. And a really special thank you again to our speakers, Congressman Dent and Councilor Sena. And again, thanks to all of you for joining us this afternoon. We'd really love for you to visit United States of Care's COVID-19 Hub, where you can find not only the state legislative recommendations that we talked about today, but also a recent memo we published about the state of contact tracing efforts in the United States, as well as our recommendations to Congress and federal policymakers as they continue to craft bills to respond to the pandemic. We continue to produce resources that we believe are useful both to state and federal policymakers in this really critical time. Liz and I and the rest of the United States of Care team look forward to working with all of you in the coming weeks and months. Please don't hesitate to reach out and let us know how United States of Care can support you and your work, whether that be through providing policy and technical support, stakeholder engagement, communications messaging, or other strategic support. And of course, appreciate all of you following us on Twitter as well, at US of Care. And with that, we will conclude today's telebriefing and look forward to being in touch with all of you.